Right now on Capitol Hill, Senate Republicans are working to push President Trump's mega bill over the finish line. We are waiting on senators to start their voting, and we are learning that Majority Leader Thune thinks Republicans have a deal to advance this bill. According to the CBO, this bill would cut around $1 trillion from Medicaid, the health insurance program for low-income and disabled people. And nearly 12 million people would lose their coverage over the next decade. One of those people bracing for impact is Allison Chandra, a pediatric nurse whose son Ethan has a rare genetic disorder. It is called heterotaxy syndrome, and that is where abdominal organs form in wrong positions within the body. The family's Medicaid coverage makes Ethan's treatment possible. And Allison Chandra is joining me right now. She is part of Little Lobbyists. It's an organization which advocates for the rights of medically complex and disabled children, of which your dear Ethan is one. But first, I know it's Ethan's 11th birthday. And that's something, Allison, you weren't certain you'd ever see. So this is a super special day to celebrate, and we're applauding you and Ethan. But tell us about Ethan's condition. How Medicaid has made his treatment possible and more financially manageable for your family.
Yeah, so I always say that Medicaid doesn't just make his treatment possible, it made our entire family possible. My husband and I had been volunteering overseas for nearly 6 years when I came home for maternity leave and found out on a prenatal ultrasound that Ethan has heterotaxy. It's a rare disease. Any of the internal organs can be missing, misplaced, malformed, or malpositioned. It's one of my favorite pictures of him. And at that appointment, the doctor told me that this is likely incompatible with life. And we were encouraged to terminate the pregnancy at that point. As a person with very deeply held pro-life values, I wanted desperately to choose life for my baby, even despite this diagnosis. And it was Medicaid that made that possible. Because I knew that if I was choosing life for him, I was choosing a life that was going to be very, very expensive, given the healthcare system in our country. He has had now 5 open heart surgeries, multiple hospitalizations, multiple other surgical procedures. I mean, he's had a lifetime of very expensive care, but Medicaid is what allowed me to choose life for him in those first really uncertain days, when no one could give us hope for a future for an 11th birthday for a kid in my living room building his birthday Lego set.
And some waving in the background, which is wonderful. So without Medicaid,
already, we're going to the water park.
Without Medicaid, what kinds of things would he not get?
He wouldn't, I don't know that he would be here.
Is it everything?
So Medicaid paid for, at the beginning, the rest of that pregnancy, and it paid for his birth and for his first 2 open heart surgeries. At that point, my husband got his green card. He's Canadian originally, and was able to get a job, and we were able to transition to private insurance. So we are one of the few families really in the heterotaxy world who is able to make do with just private insurance right now. So right now, Medicaid doesn't pay for anything, but because he's doing so well, I'm back at work as a pediatric nurse, and I do home care, and that's paid through Medicaid. So I see every single day kids whose entire lives at home with their families is funded by Medicaid and the services that it provides.
So when you say that and what you observe, even if it's not applicable to Ethan right now, it has been in the past, what are the things people would miss out on, those people that you treat?
It's everything. Private insurance only does so much, if you even have it. But beyond that, Medicaid covers feeding supplies. It covers incontinence supplies, wheelchairs, doctor's appointments, therapies, surgeries. It covers everything that children need, disabled children need, to live at home with their families where they belong.
When you met with your senator, that is Republican John Curtis of Utah, who, by the way, himself has 6 children, what was the reaction as you were trying to plead to not cut Medicaid drastically?
I was very disappointed in that meeting, especially since he himself is a physician. I would think that he would understand sort of the importance of this. He was very dismissive of my concerns. He kind of stood over us at the table. He wouldn't sit down at the table with my children and I. And basically, the message that I received was, it doesn't matter that you're here bringing me the stories of children like your son and children like the ones in Utah that you care for. I'm still going to just vote party line.
And that may be well underway very soon now. Allison Chandra, I want to thank you so much, though, for giving us a face and a family to the situation so many are facing. And again, happy birthday, Ethan. Well done, Mom.